talking about a bit about the effects on hospitals with COVID and the vaccinated cases and or unvaccinated cases. So, can you talk about the effects on hospitals because of unvaccinated cases, like running out of beds or healthcare professional services, things like that?
Absolutely. So hospitals across the nation are battling with resources, whether that is those of talent and professional personnel, from nurses to physicians, nurse practitioners, pharmacists, therapists that are going in the room taking care of patients, to ancillary support resources and people in our food services, environmental services, dietary, that are less recognized as touching the patient, but support everything that happens here and are absolutely crucial to what goes on. So every hospital in the country is battling with that. And then you talk about the physical resources of bed availability and supplies, and the pressure that is being put on being able to get those resources to take care of people. And then you step back and look at our census and say 95% of that is avoidable to a very high degree. We're sitting on a census, right here today on August 25th of 22 patients in our hospital requiring that level of care for COVID, and 20 of them are unvaccinated. And I look at the month of August and say our average census in the month of August has been 18. And if everybody was vaccinated 100%, which I know is a little bit of a stretch, but let's just say for argument's sake, 100% of this entire region was vaccinated, then our average census, being liberal, would have been 3.
Wow.
So the impact on hospitals, mental fatigue, resource burn, none of this has anything to do with cost. It has to do with people and how do we do it and how do we take care of them. I mean, I can't even quantify or qualify the impact on hospitals when we know that there is something out there that can help resolve this issue. I hesitate to call it a solution because we go back to it's not a solution. It's not 100%, but it's a medical countermeasure to what we're seeing with the virus, and it absolutely works, and it absolutely can impact the effects, and that's in the hospital. So then look at the ambulatory side, and look at our convenient cares that average 40 to 50 visits this time of year. And we've been in the 220 to 250 range. I mean, we have people, and the vast majority of that is for COVID, and the vast majority are unvaccinated. And the resource strain on that, and back to the mental fatigue, I get pretty passionate about this discussion because people ask, what can we do? And, the answer's there, but I don't want to do that. What else can I do? Well, certainly there are other things that can be done with masking and distancing, but, then we get into it again, but I don't want to do that. There comes a time that personal choices affect people and have an impact on others, and that becomes public health. And that's the line that unfortunately we're crossing, and we can't, and we've got to move back to, we're making the choices for the greater good, and doing our research to make sure that we're making that decision.
Right. Yeah. It's those numbers are just the convenient care clinic numbers. I mean, I think I heard those a couple days ago, and it's just astronomical.
It is. It's if I would have been asked before this surge, what do you think the peak convenient care number ever will be? I might have said 100, and I would have been hard pressed to say 100, because in my 8 years here and being involved with convenient care that entire time, I can remember sending extra people and having calls from staff of, what is going on? We're overwhelmed pre-COVID, and we're in the 60s. And so now you look at numbers, and last week we went 190, 200, 200 plus, 220, 250. You know, I saw the numbers from this weekend, and it was 400 plus from Friday, Saturday, Sunday.
Wow.
So and you see those numbers, and it's people that are, you know, having to do that, and the implications of that I think just totally get missed by the general public. There's people not eating. You know, you don't get to go to the bathroom. You certainly don't get to, you know, check on your family or do anything from a personal standpoint.
Right.
So the mental and physical, you know, impacts of that, the people are by far the most important thing in this organization, and the impacts of that are just something that we've never seen before. And for the most part, they do it, they get through it, and make it happen, and they show up the next day. So we thought last year healthcare got recognized for the heroes really that have always been, but it's nothing compared to this year and or this time. And now that we're seeing this surge, it's almost like there's a obliviousness to this is even going on,
right,
in some degree. Yet healthcare is just absolutely overwhelmed. And this is, I'm not touting, hey, this is just Good Samaritan. You know, I'm the administrator on call this week, and the last 2 days I've talked to the nursing supervisor, 2 a.m., then 6 a.m., the night before midnight, then 2 a.m. And we're having hospitals call us from Indianapolis trying to send patients to us.
Wow.
I've never seen that. We had a hospital over 3 hours away, over 180 miles away in Illinois, which is closer to St. Louis, which is closer to Mount Vernon, you know, towns that have equipped regional hospitals, trying to send patients to us.
Wow.
Because they don't have any beds and they don't know what to do with the patient. And in some cases, we've been able to take them, but, you know, our community, we have to take care of our community first, and our community spans 10 counties, and so we are taking patients from, you know, the outreach areas, but it's things that I never really expected to hear in healthcare. Some of the stories that I've heard, you know, patients getting transferred out of the Indianapolis area, a large metropolitan area that has every healthcare service that you can imagine. A CEO shared with our leadership team that they had to transfer a patient to Cincinnati for care.
Wow.
I mean, I've never heard things like that. And then you step back and you don't want to create this divide of it's all due to one thing. And it's not all due to one thing. And there's so many factors into it, but you step back and look at that and say 90+%, 95+% vaccinated stay out of the hospital, recover at home. The unvaccinated have such higher risk of not only hospitalization, but ICU level needs, being on a vent, death, that it's undeniable. Our good partner, Deaconess Health System, put something out with the last couple of days that's been shared kind of around Facebook of the number of patients kind of unvaccinated versus vaccinated that they're seeing within their hospital. And just and it's in a great picture, and give them kudos for putting that out there, because the picture is worth 1,000 words. But, you know, there's the vast majority unvaccinated, and then you move to ICU level of care, and that number even changes greater to there's very, very few vaccinated ending up in the ICU. If they do end up in the hospital, which is very rare, medical, surgical type of floor and recover. And then you get to the ventilator needs, you know, those that need help breathing by mechanical ventilation. They have 32 patients on a ventilator right now, and 0 are vaccinated.
Wow. This was a clip of the Good Samaritan Healthcast. If you want to hear more of what you just heard, just head on over to gshvin.org/healthcast.